Welcome to the CAR T-cell therapy education session. This presentation will help you, your family, and your friends understand what CAR T-cell therapy is and what's involved in the process. Here are the topics we will explore in more detail during this session: the CAR T-cell therapy process, the healthcare team who will be with you before, during, and after the infusion, the preparations for your infusion, including consultation, your treatment location, workup tests, and other preparations. We will also explain collecting your lymphocytes, lymphodepleting chemotherapy, your CAR T-cell infusion, and what happens after the infusion. First, let's go over CAR T-cell therapy and how it works. White blood cells form the immune system. T cells are a type of white blood cell. When the immune system is working properly, the T cells patrol the body and find virus-infected cells, foreign cells, and cancer cells, and then destroy them. Sometimes cancer cells develop ways to fool or go undetected by the immune system and are able to avoid destruction, and they multiply. CAR T-cell therapy stands for Chimeric Antigen Receptor T-cell therapy. Patients' lymphocytes are collected and sent to a manufacturing facility where the T cells have genetic information inserted into the cell. This information reprograms the T cell so they produce special receptors on their surface called the chimeric antigen receptors, or CARs. Once these cells are infused back into the patient, the CAR T cells are better able to detect and latch onto the cancer cells to destroy them. CAR T-cell therapy is a journey. There are 5 main steps involved in CAR T-cell therapy. First, patients have their own lymphocytes collected through a process called apheresis. Your lymphocytes are then sent to a manufacturing facility to have genetic information inserted into your T cells. You may require bridging therapy, that is, chemotherapy, radiation, or steroids, while waiting for your T cells to be manufactured. You'll be admitted to the hospital for chemotherapy treatment. This treatment prepares your body and creates an optimal environment for the infused CAR T cells to work. And finally, your frozen CAR T cells are thawed and returned to you through a special IV called a central line. Everyone's CAR T journey is different. Your pre-workup will take about 2 to 4 weeks. The lymphocyte collection will be 1 day in Saskatoon, and you'll be an outpatient during this time. You'll be admitted to the hospital about 3 to 5 weeks after your cell collection. Your hospital stay will be about 3 to 4 weeks, and once you are discharged, you will need to stay in Saskatoon for at least 4 weeks from the day of your CAR T infusion. Most of these 4 weeks are spent in hospital, and most patients will need to find a place to stay in Saskatoon for a short period of time. Our experienced, dedicated, and compassionate team of healthcare professionals are ready to support you every step of the way. Once you are referred to the transplant program, a hematologist will be assigned to you. A hematologist is a transplant doctor who specializes in diagnosing and treating conditions that arise in the blood and blood-forming tissues, including the bone marrow. There are 6 physicians that care for CAR T-cell therapy patients in Saskatoon: Dr. L. Emery, Dr. Sabri, Dr. Bosch, Dr. McKay, Dr. Stackew, and Dr. Kodad. You will meet one of these doctors at your consult. During your time in hospital, you will have different doctors caring for you, including clinical associates. The doctors may change depending on their schedules, but all of the doctors work together to provide the best care for you. Once you are discharged, your assigned transplant doctor will take over your outpatient care. You will meet our nurse practitioner during your CAR T-cell therapy journey. You will meet her during your initial consult and see her often at the Saskatoon Cancer Center. She will also follow with patients during their hospital stay. Upon discharge, she will provide follow-up care alongside your physician. Transplant coordinators will help prepare you for CAR T-cell therapy. They will arrange tests and procedures that are required prior to treatment. They provide teaching to you and your family about what you need to know about CAR T and possible side effects and complications. They will coordinate the timing of your therapy, corresponding with the collection of your lymphocytes. The registered nurses in the clinic are responsible for nursing assessments after therapy and organizing all your care. They are your main point of contact if you have any new symptoms or concerns once you are discharged from hospital. Apheresis, or cell collection nurses, will collect your lymphocytes used to manufacture CAR T cells. Our dedicated social workers provide support to patients and their loved ones during and after treatment. They provide counseling and support, resources, assistance with practical matters, finances, and facilitate family meetings. Our inpatient and outpatient pharmacists help teach you about chemotherapy and other medications that you take during your CAR T cell therapy. Once discharged, they will provide a medication schedule and teach you how to manage your medications at home. Pharmacists work closely with your doctor to decide which medications will help you best. The team on Unit 6100 is made up of many people who will care for you during your hospital stay. Our clinical associate physicians will provide the day-to-day care while you're admitted on the unit. Nurses, pharmacists, dietitians, transfusion medicine, physiotherapy, occupational therapy, and many other services will also help with your care. You are an integral part of the team, and you have a vital role to play in your care and your recovery. As you know yourself best, we depend on you to report how you are feeling and how the treatment and other factors are affecting you. Your caregiver will also play a vital role in this. Next, we will discuss what you can expect leading up to your CAR T cell therapy. You'll have a CAR T cell consult with our transplant team, where you'll meet a transplant physician, transplant coordinator, and social worker to talk about how CAR T therapy will benefit you, the expected time commitment, the tests and procedures needed prior to therapy, the financial costs as well as medicines and drug coverage, the role of the caregiver, the expected risks, complications, and possible side effects, and what can happen if you choose not to go through with it. Your transplant coordinator is always available to answer any questions. Moving forward with CAR T cell therapy is ultimately your decision. Rely on the information provided to you during your consult and conversations with your healthcare team. CAR T cell therapy is a lengthy process. It starts with workup, then lymphocyte collection. The lymphocytes are then sent to a facility to be manufactured. While the manufacturing process is ongoing, you may need bridging therapy to stabilize your disease. Once the CAR T cells are ready, you'll be admitted to hospital for lymphodepleting chemotherapy and infusion of your CAR T cells. Your recovery begins in hospital and will continue as an outpatient. Once you decide to proceed with CAR T cell therapy, we will begin planning your schedule. This may be a very busy time for you as you'll have many appointments. Some tests you may need to have include a disease reevaluation scan such as a PET or CT scan, a physical exam, a biopsy may be required to confirm the diagnosis, blood work including viral screening and kidney and liver function tests, an echocardiogram or an ultrasound of the heart, a CT brain, a dental appointment where you will need cleaning and clearance from the dentist to proceed. And finally, if fertility is a concern for you, please talk with your cellular therapy team. A referral can easily be made for you to speak with a fertility specialist and talk about your options. Before CAR T cell therapy, there are many steps to prepare yourself for treatment. Some of those preparations include physical, emotional, legal, financial, or other costs to consider, including finding an accommodation as well as a caregiver. While you're undergoing pre-CAR T assessment, there are a few things for you to consider. Physical preparations are important to maintain your strength and overall health so you are able to proceed with CAR T cell therapy. Exercise. Many people keep up with their regular exercise program or start a new one in preparation for their treatment. You need to be in a certain physical condition to be eligible to proceed with CAR T-cell therapy. Exercise is a positive way to channel stress and promote general well-being. Generally, the more conditioned you are, the better you will be able to physically manage CAR T therapy and recovery. Nutrition. Eating healthy and meeting basic nutritional requirements is important. A referral to inpatient or outpatient dietitians can be arranged for nutritional concerns. Hair loss. Unfortunately, you will lose your hair during this process. You may choose to shave your head ahead of time, purchase a wig, or have a favorite hat or scarf with you. Smoking cessation. If you smoke, vape, or use tobacco products, you are strongly encouraged to quit prior to being admitted to hospital. This will help you have a better chance of successful treatment, fewer side effects, faster recovery, lower risk of infection, easier breathing, more energy, and better quality of life. Once admitted to the ward, your blood cell counts will decrease, and you will be unable to leave the ward to smoke. Ask a member of your healthcare team if you need help with quitting smoking. There are a number of supports available. CAR T can be overwhelming at times. You're dealing with a lot, battling a disease, considering an entirely new, lengthy, and complex treatment plan, which comes with side effects and risks. There's a lot of new information and medical jargon to wrap your head around before you decide if this treatment plan is right for you. Understandably, you may be feeling a lot of emotions, including fear, frustration, anticipation, but also hope. Your CAR T journey ahead is full of uncertainties. The process is different for everyone, and the unknowns can be difficult to cope with. Your social worker is available for counseling sessions and can recommend other resources for emotional support. Getting your affairs in order. It's a good idea to have a healthcare directive filled out so your family and transplant team can carry out your wishes if you cannot speak for yourself. The healthcare directive discusses your wishes regarding medical treatment. It can also name a proxy or substitute decision maker. If you need help making a healthcare directive, you can use the My Voice booklet from the Saskatchewan Cancer Agency. A current will is also important to have regardless of your health status. This is a legal document that expresses your wishes. If you have questions, please speak with your social worker or lawyer, or visit www.plea.org for more legal information. Financial considerations and assistance. It is important to review your financial resources and needs. You will be required to take a leave from work for at least 3 months to 1 year after CAR T-cell therapy. The exact time period is different for everyone depending on the type of work you do and how you are feeling. Please contact your employer to find out what you have available for sick leave, short-term and long-term disability. Contact the Government of Canada regarding accessing CCP or EI medical benefits. If you need financial help, please ask your social worker. They can help with accessing other sources such as Kinsman funding. You will need to stay in the Saskatoon area at certain times during the CAR-T process. The lymphocyte collection will take 1 day. You may want to be in Saskatoon the evening before, and you may choose to stay overnight after cell collection in case you are feeling fatigued. After CAR-T cell infusion, you are required to stay in Saskatoon or within 30 minutes of Saskatoon for at least 4 weeks from the day of your CAR-T infusion. Some of this time you will be admitted to the hospital, but the rest of the time you will be an outpatient and will require a place to stay in the city. Some options for accommodations include hotels, motels, short-term rental suites, and the Saskatoon Cancer Patient Lodge. Please note that the Cancer Lodge is not open on weekends, so you will not be able to stay there after your CAR-T infusion. Please ask your social worker for an accommodations guide for more places to stay. Once your pre-assessment and preparations are complete, we can begin the next phase of collecting your lymphocytes. The process for lymphocyte collection includes 2 main steps. First, a central line is often required for lymphocyte collection. A radiologist will insert a temporary line called a Maherker line into your neck on the morning of cell collection. The second phase, or apheresis phase, we will begin collecting your lymphocytes. Here is an example of the schedule for the day of your lymphocyte collection. You will check into admitting at the Royal University Hospital at 7:30 in the morning. A central line or a Maherker line will be inserted for your lymphocyte collection if necessary. Your collection will start right after the line is inserted. The collection is done in the Oncology Day Center as an outpatient. Lymphocyte collection usually takes 1 day. On occasion, a second day may be required. To collect lymphocytes, we use a process called apheresis. Apheresis means to withdraw or to take away. Your blood, including red blood cells, white blood cells, and platelets, go into a special cell separating machine, like a dialysis machine. The machine spins the blood and separates the parts of your blood into layers. Lymphocytes are transferred into a collection bag and the remaining blood products are returned to you. Apheresis is not painful, but you may have side effects. The most common side effect is hypocalcemia, or a drop in your calcium levels, that can produce tingling, chills, and cramps. We can help manage any side effects you may experience. The apheresis nurse will stay with you during the collection, so if you have any questions or concerns, please ask. They are happy to help. We expect lymphocyte collection to take only 1 day in order to collect the necessary amount of lymphocytes. Collection usually starts around 9 a.m. right after your Maherker central line is inserted. The amount of time it takes to collect the correct amount of lymphocytes depends on your blood counts. You will be sitting in a recliner chair with your central line connected via IV tubing to the apheresis machine. You will be able to use your arms so you can do things like read, knit, or use electronic devices to help pass the time. Since you will be there for a few hours, you may wish to wear comfortable clothing. You can bring in food and snacks and eat as you wish throughout the day. A lunch tray will be provided. You will not be able to go to the washroom during your lymphocyte collection, so you will have to use a portable toilet chair or urinal bottle as needed. One visitor is welcome to come with you. It is also important to note that someone will need to drive you to and from the hospital on collection day. After your lymphocytes are collected, they are taken to our cellular therapy lab. The lymphocytes are packaged in a cooler and prepared to be picked up by a courier later that day. Your lymphocytes are then sent for manufacturing at a lab in the United States. The average manufacturing time is 3 to 5 weeks. We are able to track the progress and will keep you updated on an anticipated date for the final CAR-T product delivery back to Royal University Hospital. Your T cells are inserted with new genetic material at the manufacturing facility. This new genetic material gives instructions for your T cells to produce chimeric antigen receptors, or CARs, on the surface of your T cells. Once this is successful, the small batch of CAR T cells will be induced to multiply until there are enough CAR T cells to effectively target the cancer cells in your body. These cells are then frozen and shipped back to Saskatoon. They can be stored until you are ready to receive them. Once your T cells are sent for manufacturing, you may or may not require bridging therapy to prevent disease progression while we wait. The goal is to prevent you from getting any complications that could be caused by your cancer. The goal of bridging therapy is not to achieve disease remission, but to control the disease. Bridging therapy can be done in a variety of ways, including chemotherapy, immunotherapy, radiation treatment, or steroids. Your CAR T-cell therapy infusion will take place at Royal University Hospital on Unit 6100. The admission date to hospital is based on manufacturing dates and when your product arrives back in Saskatoon. Further staging may be required before admission, for example, a PET CT. An appointment will be done at the time of the admission to speak with your transplant physician and ensure you are ready to proceed with CAR T-cell therapy. You will need a PICC line inserted for your CAR T-cell therapy. A PICC line is a long, flexible tube inserted in your arm. Your PICC line will be used to infuse the CAR T-cell therapy product, draw blood tests, give chemotherapy, administer IV fluids, medications, and blood transfusions as needed. The PICC line will be in place for the duration of your hospital stay. You may be discharged from hospital with a PICC line if you still require IV medications or blood transfusions as an outpatient. About 3 to 5 weeks after your lymphocyte collection, you will be admitted to Unit 6100 at Royal University Hospital in Saskatoon. You will stay there for about 3 weeks. This includes chemotherapy, CAR T-cell infusion, and recovery. If you have any problems throughout the course of your hospital stay, you may have to stay in hospital longer. You, your family, and your caregiver are an important part of the team, and we want you to ask questions and share information with us throughout your journey so that we can give you the best possible care and help in your recovery. Please note, you may be admitted to a public room at the start of your admission to ensure that you get a bed, but you will be moved into a private room shortly thereafter. Visitors are allowed and encouraged on Unit 6100. There are no set visiting hours. Please review the visitor policy upon admission and note that no fresh or dried flowers are allowed on this unit due to risk of infection. All visitors must be healthy, they must wash their hands when entering the unit, and they must wear a medical-grade mask. Sleep chairs may be available in the room if you would like someone to spend the night with you. There are no shower facilities available for visitors to use. You may wish to bring a few things from home with you to the hospital. We recommend that you consider bringing fun activities and games that will help pass the time, such as books, crafts, puzzles, crosswords, a laptop, computer, or phone, including chargers, your own clothes or comfortable pajamas if you choose. Please note that no laundry facilities are available at Royal University Hospital. Comfortable walking shoes. Toiletries are provided, but you may want to bring your own soap, shampoo, soft toilet paper, Kleenex, toothbrush, or toothpaste. Photos to decorate your room and hang on your whiteboard are also encouraged. You may also want to bring in shelf-stable snacks to be kept in your room. There is a communal fridge that staff can store your label snacks in. Family members may also bring in meals for you. We recommend that you refer to the dietitian handout about what types of foods to avoid while your immune system is low. You also need to follow the proper safety precautions for preparing food for patients with immunocompromised systems. Let's go over everything that you might need to know about the process of lymphodepleting chemotherapy and your CAR T-cell infusion. Once you've been admitted to hospital, you will start lymphodepleting chemotherapy the next day. Chemotherapy treatments create a favorable environment for the CAR T-cells to grow and function in your body. The chemotherapy regimen will be specific to you and your disease. It will be given for 3 to 4 days over a 5 to 6 day period. We consider day 0 to be CAR T infusion day. The days before day 0 is the chemotherapy phase and are considered negative days, such as day -1, day -2, etc. The days after day 0 are positive days, day +1, day +2, etc. After lymphodepleting chemotherapy, you generally have a 2-day break before you receive your CAR T cells on day 0. Receiving a CAR T cell infusion is almost like receiving a blood transfusion. CAR T cells are removed from cryopreservation or freezing and will arrive from your room still frozen. They are thawed in warm water right at your bedside immediately before they are given to you through your central line. You will receive pre-medications prior to the infusion. The CAR T infusion will take less than 1 hour, and your vital signs will be monitored throughout the procedure. Once CAR T cells are infused into your bloodstream, they begin to multiply in number. The CAR T cells then target, attack, and destroy your cancer cells. We use a preservative called DMSO to freeze your CAR T cells. DMSO gives off a smell that some people compare to creamed corn. Your visitors might notice this smell a short time into the infusion, and it can last a day or 2. While you might not notice the smell, you may have an odd taste in your mouth. Sucking on hard candies or eating orange slices can help with the taste. After your CAR T cell infusion, the team on 6100 will help you manage your side effects. You may begin to feel tired and unwell from side effects of the chemotherapy. Fatigue is common, especially while your blood counts are very low. Fever is often the first sign of infection, and you may require IV antibiotics to fight an infection. You will experience hair loss because the treatment damages cells that grow quickly, and your hair is made up of fast-growing cells. You may develop mucositis. Mucositis is when the mucous membranes become irritated and swollen. This can lead to painful sores, bleeding, and infection in the mouth. Good mouth care can help prevent infection and promote healing. You may have medicines to help control diarrhea, nausea, or vomiting. It is possible that you may experience organ damage, for example to the kidneys or liver. This is usually reversible. Most of these problems are worse when your blood counts are very low. Cytokine release syndrome, otherwise known as CRS, is a common and expected side effect after CAR T cell infusion. CRS happens as the immune system becomes activated by the CAR T cells traveling through the body. Sometimes the immune system overreacts and releases more chemicals, called cytokines, into the system than it should. Symptoms can be mild to severe. If you do develop CRS, it usually happens within the first 5 days after infusion. Symptoms can include nausea, fatigue, headache, chills, fever, low blood pressure, high heart rate, low oxygen levels, or organ failure. You may require treatment such as oxygen, IV medications, or steroids. Severe CRS might require you to be admitted to the intensive care unit or ICU. Symptoms of CRS are usually reversible, but in severe cases, they can be life-threatening. Another common side effect of CAR T cell therapy is called immune effector cell-associated neurotoxicity syndrome, otherwise known as ICANS. In some patients, immune activation after the CAR T cell infusion can alter the brain and neurologic system temporarily. If you do develop ICANS, it usually happens within the first 10 days after infusion. These changes can appear as confusion, agitation, difficulty speaking or writing, tremors, memory changes, loss of consciousness, or seizures in severe cases. Again, you may require admission to the ICU if you develop severe ICANS. We expect the symptoms of ICANS to be reversible in most cases. Your team will monitor you frequently and give you special medications to control it if needed. Both during and after your CAR T cell infusion, you will be closely monitored. The nurse will draw your blood work every morning around 6 a.m. to check for low blood counts. You may need blood or platelet transfusions. Most patients require IV antibiotics. You will be monitored closely for signs of infections, and you will get a daily weight check. Expect the nurse to monitor your oral intake and output daily. As part of your daily routine at the hospital, you will need to shower daily to maintain good hygiene and lower your risk of infection. Wash your hands frequently and use hand sanitizer. Follow proper mouth care, which includes brushing your teeth regularly, rinsing your mouth frequently with club soda, or prescribed mouthwashes to prevent mouth sores or infections. It is also important to exercise and stay active to maintain your strength. Being strong can help recovery and lead to earlier discharge. You will work with a physiotherapist who can provide you with exercises. Be sure to keep eating and drinking, even in small amounts, throughout the day. The treatment may affect your appetite and ability to digest food. You may experience nausea, changes in taste and smell, and difficulty swallowing, but it's important to continue to eat and drink. You can do your part to reduce your risk of infection by following a few basic principles. Practice good hand hygiene. Wash your hands regularly, for example, before meals, before taking medications, and after using the bathroom. Ask your visitors to isogel or use hand sanitizer when they enter your room. We also ask that they wear masks while they are visiting. Encourage your visitors not to come to the hospital if they aren't feeling well. In this next section, we will discuss what you can expect after you are discharged from hospital. Expect to stay in the hospital for about 3 weeks after your CAR T-cell infusion. You will be ready for discharge when you have no signs of active infection, are not requiring IV antibiotics, or are able to take oral antibiotics at home. You must be taking all of your medications by mouth. You must be eating and drinking an acceptable amount. You must be mobile and have the strength to complete your regular daily activities. It's important to note that your energy level will not yet be back to normal. What to expect after discharge from hospital. Your PICC line may be removed on the day of discharge, or you may be discharged with the PICC line in place if we expect you to need it as an outpatient. You may need blood work several times a week for the first few weeks. It's helpful for your caregiver to attend all of your outpatient appointments. Remember, you cannot drive for a minimum of 8 weeks after CAR T-cell infusion, so you will need someone to bring you to your appointments. Caregivers can also help you keep track of any changes to your medications. You can expect to attend many different appointments and treatments after leaving the hospital. How often you are seen depends on your own specific health concerns, but generally you will be seen at the cancer center 1 to 3 times per week for the first few weeks to monitor for side effects after CAR T. You may need blood or platelet transfusions or supportive care like IV hydration. It is not uncommon that you may need to be readmitted to hospital if side effects cannot be managed as an outpatient. Day 100, or 3 months post-CAR T, usually marks the end of the early recovery phase. At this time, you may require a bone marrow biopsy, CT scan, or PET scan to reevaluate your disease status. Your doctor and the transplant team will let you know once you are well enough to return home. You will be on many medications after discharge depending on your individual needs. These may include antivirals, antibiotics, antifungals, electrolytes like magnesium, potassium, and calcium, anti-nausea medication, antacids, or others as needed. You will be given a CAR T-cell therapy alert card to keep with you at all times. Please present this card immediately to staff at the emergency department if you need to seek care for any reason. This card will indicate to the staff that you should be triaged as an urgent patient and placed in isolation. Carry this card with you at all times. After CAR T-cell therapy, you may notice changes in your desire and sexuality. Men may experience lower testosterone levels after chemotherapy, and this shows up as a lower sex drive. Women may experience hot flashes, vaginal dryness, or decreased interest in sexual intercourse. In general, sexual activity after your hospital stay is considered safe to participate in, unless you have low platelet levels, which put you at risk for bleeding, or your neutrophils are low, which makes you more likely to develop an infection. Your dedicated caregiver will be your key support throughout your recovery journey. Your caregiver is usually a family member or close friend that is very reliable and can commit to the full-time responsibility of looking after you after CAR T-cell therapy. The amount of time you need a caregiver for will depend on your general condition and recovery course after treatment, but you must plan to have a caregiver live with you for at least 8 weeks from the day of your CAR T-cell infusion. Again, some of this time will be spent in hospital, and your caregiver does not need to be present with you while you are in hospital. CAR T-cell therapy is not something you can manage by yourself. You may feel very tired and weak and experience complications after CAR T-cell therapy. Your caregiver can help you with daily tasks, such as transportation to and from appointments, as you can't drive for 8 weeks after CAR T due to increased risk of seizures. They can help with organizing and scheduling your medications, monitoring your health and vital signs like your temperature, providing nutritional support and preparing meals, maintaining your home environment, such as cleaning and laundry, and shopping. Caregivers must live with you, but they can leave for short periods of time, for instance, to get groceries. Caregivers should be available by phone at all times. Being a caregiver can be very demanding. Caregivers take on a lot of responsibility and manage a lot of information. Your caregiver will also need to practice self-care by taking breaks, maintaining personal time, getting enough sleep, and eating. Counseling support is available for caregivers through our social workers. What will life look like going forward? It can take months to recover from CAR T-cell therapy. In general, you can expect to be off work for at least 3 to 12 months. Your recovery depends on many factors like your overall health status, your age, medical complications, your prior level of activity, and other individual factors. Some patient recovery time is relatively short, while for others the recovery period is quite slow. Some patients will never feel the same as they did before CAR T-cell therapy. In general, you can expect to experience fatigue after CAR T. You may experience side effects from medications. You will need frequent blood work, follow-up appointments, and possible platelet or blood transfusions. You may experience infections, and you may require readmission to hospital to manage complications. Please remember that CAR T-cell therapy is not always successful. Some patients will relapse after CAR T-cell therapy. It's normal to feel a bit lost after discharge from hospital. Some patients feel down or anxious as they transition from hospital to home. You may need to be readmitted if any problems come up. This can be disappointing, but it's not uncommon after CAR T. Some people expect to feel as well as they did before they got sick. This is not always possible, especially early on. You will still require help from your family after CAR T-cell therapy. Family members and loved ones might not understand how long it takes to recover, which can cause relationship struggles. To keep yourself healthy during your recovery, we recommend that you have your house cleaned prior to coming home. Change the air filters in your furnace. Keep your environment clean. Note that plants and soil contain bacteria, mold, and fungi, so they should be avoided. Avoid new construction, sawdust, and environmental chemicals like glue or paint. Keep your hands and body clean by practicing frequent hand washing and bathing daily. Family pets can stay in the home, but someone else needs to clean up after them. Avoid crowds by visiting public places during less popular or busy times. Protect yourself from the sun, Stop smoking and avoid secondhand smoke. And do not wade or swim in pools, hot tubs, ponds, or lakes. Your immune system will be weak after CAR T, and you will be at risk of getting an infection. It can take up to 2 years after treatment for your immune system to work normally. Infections can be bacterial, fungal, or viral. They are most often passed on from person to person, but they can also come from plants, soil, the outdoors, from animals or insects, tainted or undercooked food, or from germs that live inside your body. CAR T cells are engineered to target a marker on your cancer cells that are also present on healthy B cells. B cells are a type of immune cell that play an important role in preventing infections. After CAR T cell infusion, you will have a very large drop in the number of B cells in your body. You may require a product given through an IV or as an injection in the belly called immune globulin therapy. This helps support your immune system after CAR T cell therapy. In addition to immediate complications after CAR T cell therapy, you may experience delayed or long-term problems like severe infections. Infertility is common after CAR T. Fertility preservation should be considered prior to starting chemotherapy if you are interested in having a family down the line. You may experience cataracts or other eye problems, bone complications like osteopenia or osteoporosis. We use bone density testing periodically after treatment to monitor for this. You may have prolonged fatigue. Unfortunately, you may have a relapse of your original disease. Routine scans and bone marrow biopsies may be done to monitor for relapse. And finally, you may develop a secondary malignancy or a new cancer like leukemia or skin cancer. After CAR T cell therapy, you will need to be re-immunized for all of your childhood vaccines. You will receive letters in the mail indicating when you are eligible to schedule those vaccines. The approximate timeline is as follows. Around 4 months, you will receive the influenza and COVID vaccines. Around 6 months, you will need the pneumonia vaccinations. At 1 year, you will receive all killed vaccines such as hepatitis B. And at 2 years, you will receive live vaccines like the measles, mumps, and rubella. Most patients can return to work in about 3 to 12 months after CAR T cell therapy. Of course, this varies based on how you are feeling and your work responsibilities. It may help to resume working slowly. As for traveling, we recommend that you speak with your healthcare team if you are planning to travel within the first 3 months after CAR T cell infusion. Camping, hunting, and fishing are discouraged during the early post-CAR T period due to risk of infection. It's important to prioritize your health and wellness. Make sure to continue regular activity and exercise. It may be helpful to follow a regular exercise program. The physiotherapist in the hospital can help decide what type of exercise is best for you. Fatigue after CAR T cell therapy is very real. Give yourself time to rest. Fatigue can last for several months after treatment, so increase your activity over time as your energy levels increase. Some tips for reducing stress and feeling more relaxed include listening to meditations or music, watching a funny show, practicing deep breathing, seeking out local support groups, focusing on your spirituality, or by doing any activity that makes you happy. Remember to take it one day at a time. Be gentle with yourself and others, including your caregiver. Allow yourself to feel and express your emotions. Make your needs known to yourself and the people around you, and lean on your family, friends, and caregivers for support. The following links include more information on advocacy, peer support, support groups, online chats, and other resources around CAR T cell therapy. If you have any other questions or concerns, please visit saskcancer.ca for more information and resources. You can also reach out to your transplant coordinator anytime, and they would be happy to help or answer any questions you may have.